Hello, that's Dr. Surmili. In this video, I want to share brief information about our approach to safe practice for international patients. Also, I want to list the most common procedures in our practice, what we offer, and what makes our clinic unique. What's our approach to safe practice for international patients, and what are the limitations? Although I am a fully trained plastic surgeon to do almost every procedure, there are certain limitations in doing all sorts of surgeries, as some of them would require a multidisciplinary approach or may require additional specialization and equipment. Perhaps the most important factor is that most of our patients are traveling from abroad and their management differs vastly from the other patients. That difference plays a major role both in patient selection and in the extensiveness of the planned procedure, especially if it's a combination surgery. Therefore, we tend to prefer the safest procedures suitable for the patient's overall health condition, and we try to minimize extensive multiple procedures. We try to avoid performing surgeries for patients with systemic conditions such as diabetes, obesity, uncontrolled hypertension, autoimmune diseases, or for patients who are under treatment for psychological disorders. That approach is essential for doctor and patient safety, and is particularly important for international patients for whom the solution of problems could be quite challenging. What are the most common procedures in my practice? Partially shaped by the reasons I have just mentioned, certain procedures are more common in our practice. These procedures are rhinoplasty, nose job, breast surgeries, augmentation, lift or reduction, liposuction body contouring with or without buttocks enhancement, facial rejuvenation procedures including facelift, neck lift, eyelid surgeries, lip lift, double chin lipo, chin augmentation, buccal fat removal, and tummy tuck. In addition to that, we do female genital aesthetic procedures such as labiaplasty and labial fat transfer. We perform mole, lipoma, cyst, skin tumor removal, and their reconstruction if needed. We also do Botox and injectable filler treatments, hydrofacial skincare, PRP injections, microneedling procedures. We offer international surgery packages, including accommodation, transfers, preoperative tests, and follow-up visits. Also, depending on your surgery, we may offer additional services such as lymphatic drainage massage for liposuction patients. Even though it would be way better to have a companion to travel with you, if you are traveling alone, we may offer private nurse services, provided that this should be planned ahead of time. So basically, all you have to do is just to check for availability, buy your flight tickets, and our professional team will arrange the rest. What are the main points that distinguish us from other clinic companies? I'd like to answer that question by sharing the most common feedback from our patients. The professionalism, the seriousness, and the quality of medical care are the most common feedback we got. We value our patients' trust, and we try to do our best for their safety and satisfaction. We prioritize patient safety above anything. In compliance with that, we do not operate on every patient if the expected outcome is not possible to be achieved, or if the patient's medical condition imposes additional risks that will put the patient in danger, or if the surgery requires multiple sessions with a need for close follow-up, which would not be possible for international patients. In our clinic, you know your doctor's name. You will never be forced for surgery just minutes after a careless consultation on the day of your arrival. That was a summary of our practice and our approach to international patients. Contact details and website link are in the description. Thanks for your time and wishing the best.